breaking the wall of undiagnosed diabetes complications. José L. Flores-Guerrero, Falling Walls Lab, Mexico.
Diabetes is one of the most important public health problems in the world, with 1 in 5 adults at risk of having diabetes and causing the death of 1 person every 6 seconds. I have been studying diabetes for more than 10 years, and I can tell you that there is not a single organ free of the consequences of diabetes. However, the most striking fact is that more than 50% of the population with diabetes do not know that they have the disease. During my PhD, I have been investigating novel molecules that can predict the development of diabetes and its complications. Some of these molecules are essential amino acids, fragments of cholesterol, and molecules that are produced in the bacteria that live inside of us. With my research team and I, we have published more than 20 scientific articles showing the clinical utility of these biomarkers. Unfortunately, the measurement of these biomarkers is expensive, it is invasive because of the blood sample, it is restricted to very few locations, and it involves the use of a lot of chemical contaminants and tons of single-use plastics. These 4 limitations are critical in low and middle-income countries and represent a big wall to break in order to predict the development of diabetes and stop its complications. Together, in a multidisciplinary team of physicists, chemists, and medics, we had proposed the use of Raman Spectroscopy to identify these novel biomarkers. We apply a laser on top of the skin of the patient for 2 seconds, and the laser provokes a vibration in the molecules, and because the molecules are different, it produces different spectra. Machine learning and other statistical methods allow us to disentangle these spectra, identifying these biomarkers and its concentration in the circulation of the patients. Our method is not invasive because we don't need to extract any blood sample, and therefore more people is willing to have a test. It is low cost because 1 laser can be used hundreds of thousands of times. It can be taken to remote areas because the device is smaller than a laptop, and it's sustainable because we don't use any chemicals or any single plastic. Together, we are proposing to use this method to break the wall of undiagnosed diabetes and its complications. Thank you for your attention.